So we're going to check to make sure that this is the tooth that needs to be replaced with a crown. And as all other procedures, we're going to perform the anesthetic procedure. So now we'll select the shade of our crown. This one. And the assistant will record it in the prescription pad. And now we'll check to make sure the anesthetic has taken effect. And we'll begin with the high-speed handpiece. So what we did was opened up the contacts between the teeth so that we could allow for space to put the retraction cord in. So now the assistant will take the thick retraction cord and just soak it in water, just so that it's easier to pack into the sulcus. And we'll wrap it around the tooth, and using the plastic filling instrument, we'll insert it into the sulcus. So now we're going to put the dental dam on, and we're using the slit technique. So we're going to place it from 3 to 3. And as long as it stays in place, you don't need any retraction or wedges. And it should be stable. Okay, so now the dentist is going to change to the diamond instrument and continue to prepare the crown and cut the tooth down into an abutment. Okay. So now at this point, we're going to remove this retraction cord that was placed. And we'll continue on with a bit of the handpiece, just to fine-tune the prep. And then we'll use the straight chisel just to finish up the abutment. At this point then, we're going to put the thin retraction cord in. And the dental assistant has placed it in water as well so that it can be easily placed into the sulcus. And then following by the second piece of thick retraction cord. This is going to go around again on top of the thin and pack that into the sulcus. Okay, so as soon as that's done, then we're ready to remove the dental dam. So because we didn't use a clamp, we're just going to remove the dam easily. And now we're ready to try on our temporary crown and prepare it for cementation after the final impression. So the dental assistant will take the temporary crown from stock crown forms, and we'll just try it on, make sure that it fits. We'll use the tongue depressor to bite down and insert it over the abutment, and just making sure that it fits and that it's going to be a relatively good match. And again, remember, it's temporary, so it doesn't have to be perfect. And now what we're going to do is just check the margins and make sure that it fits. So with an Explorer, we're going to just go underneath the margins in the sulcus and check to make sure that we are going to have a pretty good match. This is so that when the cement is placed in the crown, the cement can come up through the sulcus and give a real good bond. The temporary will only be in place for a week, maybe 10 days, but we still want it to be secure. So now we'll use the articulating paper. We'll ask our patient to bite down. And when they bite down, we take a look to make sure that they're not going to be biting on areas that will knock the temporary crown off in place. Now the temporary crown looks pretty good, so this is the one that I'm going to hand back to the assistant and let her know that this is the one I want you to fill with temporary cement when it's time to put it in. So now we hand the crown back to the assistant so that she can fill it with cement later on. So now we're ready to start with our final impression material. Before we do that though, we have to remove the thick retraction cord. So we're going to just pull the cord out of the sulcus and remove it, but the fine cord is staying in place. So now the assistant passes the fine-bodied elastomeric material. So we're just going to extrude it around the tooth, and the assistant uses the air ever so gently just to push the material into the sulcus and around that fine cord. The heavy-bodied elastomeric material has been inserted on our triple tray. Before it can be seated, the mirrors are used to retract the cheeks and place it in the mouth so that we have a good seating. Now we'll ask the patient to close up, bite down on the triple tray, and then we insert the saliva ejector for their comfort. Now at this point you can put the patient up because they'll be holding this in place for about 5 minutes until it sets. You want to make sure that their comfort is always first in your mind, and talk to them, don't leave them. Okay? So in the meantime, this is all set and we're ready to remove our impression tray. So we'll just ask our patient to put their head back down and relax. The whole chair would have been raised. So we'll remove the saliva ejector. Then we'll ask the patient to open up. And we'll remove the triple tray. Now when you remove the triple tray, you've got the thin ray cord stuck to the fine-bodied impression material that's embedded in the heavy-bodied impression material. So the assistant will take this now and set it aside and get it ready later to send back to the lab. So in the meantime, what we need to do is clean up the area here. We'll remove a little bit of the elastomeric material that may have stuck in between the teeth with some floss. And then we're ready to cement a temporary crown. So we'll ask the assistant to mix up the temp bond. And what she's doing now is filling up the temporary cement into the crown. So now we'll take this temporary crown and insert it right over top of the abutment. And then we'll ask the patient to bite down on the tongue blade to insert it so that it's subgingival, that the margins are subgingival. We can also use crown cedar. So when our patient bites down or it's seated, it's right in place. Okay. Now we'll use a scaler. Thank you. And around this, what we'll do now is we'll just remove the excess cement that's under the gum line. Double check that it's all nice and clean, and the temporary is a pretty good match. So now the assistant is going to take the impression that we've made and disinfect it and place it in the bag. The bag will be labeled with the patient's name, the due date that it comes back to the office, and send it off to the lab with the prescription that's been written up in the prescription pad. And then the prescription will also have the shade listed on it and all the information that we need the lab to know to be able to create this permanent crown.